what we'd like to do next is present some case studies of what is happening on the ground, and some potential solutions. I'm coming at it from a focus of OBGYN and GYN oncologist trying to think about how do we tackle cervical cancer globally in terms of prevention and screening and treatment. And so I'd like to introduce one of my colleagues, Dr. Surbhi Grover, who's a radiation oncologist at the University of Pennsylvania. She's been based in Botswana for a number of years as part of the University of Pennsylvania, University of Botswana partnership. And she's thought a lot about both how to deliver good cancer care in Botswana, as well as how to improve both medical imaging and radiation oncology across Africa. So, Surbhi, please go ahead.
Thanks so much, Joanne and Ted, for this opportunity and to be able to remote in from Southern Africa. So I wanted to just start off, as we're hearing a lot about this gender lens investing and strategy, I wanted to just start off with just laying the stage here in terms of health in Africa. So the largest burden of women's cancers, which is cervix and breast cancers in Africa, over 50% of all cases around the world actually exist here. And over 80% of the mortality happens here in Africa. And these women that are dying of cervical cancer are young women in their early 40s. So there's a huge, huge opportunity cost to the society for these women not being able to, do all the jobs that they're doing. And majority of these women, are HIV positive. And while HIV is now really well taken care of, thanks to PEPFAR and several other stakeholders, it's sort of a chronic disease. More of these women are getting advanced cervical cancer. And how do you treat this advanced cervical cancer? Well, the primary treatment for most of locally advanced cervical cancer is actually radiotherapy. And there's only about half of the countries in Africa that have access to any radiotherapy, and even less that have access to quality radiation therapy. So that's a big challenge. And why is that? One, there's issues with human capital, so there's not enough human resources to run it. Second, there's a big infrastructure cost for setting up radiation therapy, even though it's a treatment that's needed to treat 70% of all cancers around the world. And for cervical cancer in Africa, it's about 90%. And even though half of our treatment volume in oncology clinics is cervical cancer, we still don't have access to radiation, to reliable quality radiotherapy, because of human resource issues, because of initial infrastructure investment, and issues around the payment models. So, I think with technology and AI, we're starting to see solutions that will finally have some answers. And I've been treating women with cervical cancer since I finished residency in the US. I moved here, like Ted mentioned, since 2014. And the burden of these cancers is not going down. And what we constantly see is to get women through treatment, there are several challenges. And some of those are in care navigation and delays and patients just getting lost, and having access to quality treatment as well. So one of the applications that we actually built here using technology solutions called OpCare, it's really helped us in one, communicating with patients so they understand when their appointments are, when they need to show up for treatment so they don't fall through the cracks. And it also really helps us with care navigation. So we know at various phases where the patients are, and then all of their treatment records, et cetera, can be just collected in the same application. And this application is very easily used by our care providers, our nurses, all the health providers in the system. So it's really helped us get patients through timely treatment and improve their quality of treatment, and then also have access to data that helps us improve further. The other solution that's underway is a more AI-based tool. And like I mentioned, delivering radiotherapies, could be challenging, particularly in Africa, because of access to all the human resources, not having access to radiation oncologists, radiation physicists, and therapists. And this AI tool that actually originated out of Australia through Genesis Care, that's really helped really think about how to get the right prescriptions that are evidence-based, and having more automated planning using the AI tool to have quality plans, which will allow us to treat more patients, get more patients through treatment, but not just get patients through treatment, actually get them through quality treatment. So overall, we can actually cure more women. So, so I think, in addition to sort of thinking about public-private partnerships to really set up these centers, really relying on technology and AI is really key to get better treatment, quality treatment, and improve access to treatment.